respiratory. So we're going to cover intrapulmonary versus intrapleural and tidal volume. So if you take a look at intrapulmonary, what does intra mean? Within, and then the lungs. Intrapleural is within the pleural space that separates the lung parenchyma or the lung tissue from the wall. So this is how you're going to take a look at this. Like I said, this is a rendition of the alveoli, and this is the lung tissue. So anything within the lung, so these open spaces here, they're calling intrapulmonary. So like I've said before, the inside in here can become positive pressure or negative pressure depending on whether or not I'm squeezing or opening up the chest wall. So if I open up the chest wall and the volume inside, like the bellow, what happens to the pressure inside? The pressure becomes negative in relationship to the atmosphere. So we're going to say the atmosphere is set to 0. If I make this a number less than 0, then it's a negative number. That means air will move into the lung. That's inspiration. But what if I make, I close the chest wall using muscles and I make the inside of the pleural space, or I'm sorry, inside of the alveoli and the airways, I make that positive, then it's like pushing air out. That's called air expiration. So intrapulmonary, if you look in the diagram, it has a negative and a positive. So at one point, if the inside is equal to the outside, the pressure on the inside is equal to the outside, then there's no air movement. What is intrapulmonary? What is intrapleural? Intrapleural talks about the negative space found inside of the pleural cavity. So what is the point of the pleural cavity? Well, the tissue of the lung is really soft and the chest wall is really hard. How do I get the two of them to work together? I create a little vacuum seal. So if you've ever done this before, you store your clothes away inside of the vacuum bag, and then you use a vacuum to suck out all of the air, and you try and pull on the two parts of the bag, right, where the clothes are sitting. The harder you pull, the harder it is to actually separate. That's a negative pressure in there. That's a vacuum seal. So intrapleural and intrapulmonary are different. Intrapulmonary has open access to the outside environment. Intrapleural is just an enclosed, vacuum-sealed environment where if the chest wall expands, it creates a negative pressure that pulls the lung tissue outward. So if you look at this, the numbers are all negative. If it becomes more negative, that's like saying inspiration. If it becomes less negative, that's expiration. And this one here, don't worry about the arrow where it's pointing to. Lung volume or tidal volume is just a normal volume of air that you breathe into and out of while resting.